My name is Megan Hamilton, and I will be talking about healthcare in Indonesia versus the United States. In Indonesia, it is a mixture of both public and private providers. In the United States, it is also a mixture. We are best described as a hybrid system. In Indonesia, as of 2014, the government has implemented the JKN coverage plan. The goal of this is to provide universal healthcare coverage by the end of 2019. As of right now, 70% of the population participates. This graph shows the current progress of the JKN coverage, and you can see here in 2014 when it was implemented how much it has increased already. In the United States, we do not have a plan like this. However, policies such as the Affordable Care Act were implemented as an attempt to lower healthcare costs, make it more affordable for people who may not have access to it. Right now, the United States, about 89% of people are covered, but about 32.9 million people remain without insurance, so this is still a major issue. Life expectancy in Indonesia is about 69 years. In the United States, it is 79. The world average is about 80 years, so we lie below the line on both ends. In Indonesia, the infant mortality is something that has gone down significantly over the past few years. However, maternal mortality remains very high, as well as high incidences of TB and malaria still remain to be an issue. In the United States, smoking tobacco remains a major factor, as well as drug overdoses. How to help this? Preventive care and education will help both countries. Vaccination specifically will help in Indonesia against TB and malaria. And for addressing the tobacco, one way to help that is taxation on tobacco products to help decrease the use. Healthcare expenditure in Indonesia is about $99 per capita. In the United States, however, we are about $9,000 per capita. Here I have a graph comparing the two, which are almost not even comparable. The United States being significantly higher than Indonesia. In the United States, about more than one in four families has experienced financial burden from medical costs. This is due to the rising prices for healthcare, unnecessary tests being done, higher price for treatment and prescription drugs. This graph on the bottom represents health spending per capita compared to the life expectancy. So as you can see over here, the United States is extremely high in their spending. However, we still lie below the average for life expectancy. In Indonesia, they are very low on the spending per capita, and as a result, they are very low compared to the world average for life expectancy. Breast cancer in Indonesia remains to be a huge issue. Breast cancer is actually the leading cause of death in females among underdeveloped countries. The United States, about 14 per 100,000 for mortality rate, and in Indonesia it's about 16 per 100,000. However, the incidence for United States is about 76, where Indonesia it is 36. So United States has significantly higher incidence rates. However, the mortality rate in Indonesia is still higher than in the United States. This is due to early detection. In the United States, it's not that big of a problem. Many people get mammograms every year. In Indonesia, a survey was done and less than 5% of the population was even aware that mammograms were used for breast cancer detection. So education is a huge part in this for Indonesia. Breast cancer awareness programs are crucial. Due to their lack of resources, they are not able to implement things such as mammograms in Indonesia all the time. So self-examinations are very important in early detection, sometimes the only way for them to be detected early in places like this. Children vaccination rates in Indonesia and the United States are actually the same at about 72% of children receiving the proper vaccinations. So this means about 1/4 of infants every single year are not being immunized against basic childhood diseases. In 2003, immunization saved the lives of 2 million children. However, there were still about 1.4 million children that died from diseases that could have been prevented from vaccines. What can we do to help this? Education, again, is huge. Many people are still skeptical on vaccinations. They are scared of the side effects, so they don't think they're very effective. However, immunization and vaccinations are extremely effective, and parents should be very aware of that to make sure their kids are getting vaccinated. One of the plans that are in place right now is the Global Vaccine Action Plan. This looks at 6 goals for over the country on how they're going to close the gap in vaccination rates, and endemics such as polio and measles is still an issue in some countries. Drinking water, I looked at the percentage of improved water available. Improved water includes things such as public water and sanitary water that are available for you. In Indonesia, there's only about 80% have access, and in the United States, about 99% have access. So in the United States, this isn't that big of an issue. However, in Indonesia, especially for people living among the riverbanks, if they do not have access to improved water, the riverbanks is their main resort, their first resort. And in places such as Jakarta, 90% of the groundwater is actually contaminated with E. coli. So this obviously puts them at a very high risk for waterborne illnesses. The reason the water is so contaminated is due to their lack of sanitation systems. If they, much of the waste is just dumped into the rivers, so this puts many people at risk. Government is raising awareness through awareness campaigns and educational campaigns. They're also on a 10-year plan to help clean the river, but no matter how much work is done, the river will never be back to how it was due to the extremely high amounts of pollution. Access to care. The physician density in Indonesia is about 20 per 100,000. In the United States, it's about 257 per 100,000. So you can see we have a significant difference in numbers here. This graph looks at the global burden of disease percentage and the global physicians. The circles actually reflect the regional share of global expenditure. So as you can see, America being the largest circle for the most expenditure. However, we are still only accounting for about 20% of the world's supply of physicians, and we have about 10% of the global burden of disease. Indonesia only accounts for about 1% of global expenditures. However, they do have the highest proportion of global disease, being at 29%, and they are only accounting for about 11% of global physicians. So the more physicians going to underdeveloped countries such as Indonesia can help reduce the proportion of global diseases as well. Poverty levels in Indonesia, about 10% are living below the poverty line, and in the United States, about 15% are living below the poverty line. So this is still a major issue for both countries. Indonesia has actually been able to cut their poverty levels in half by job creation in the cities. The World Bank is a huge factor in Indonesia helping out. They support implementation of government programs, and they're continuing to help generate jobs. In the United States, one program is the Hamilton Project. It has commissioned about 14 proposals addressing different topics such as childhood development, a safety net, and a work support. In conclusion, the U.S. spends way too much money on healthcare, and we need a better plan to find something that works for everyone to promote universal healthcare coverage. Indonesia needs more access to care in general. They need more physicians. They need safer drinking water, sanitation systems, and breast cancer awareness, again, is huge in places like Indonesia for early detection. Both countries need to continue preventive care and education on vaccinations and immunizations in general. Programs to help with poverty and work support as well to lower the poverty rates. That had to be longer. That was probably too long.